This is an audio check from the podium mic. No? Mic check, testing 1, 2, 3. Can the reporters on the Zoom call hear the podium microphone? Okay. How about now? Okay. Testing 1, 2, 3, 4. Perfect. We will begin shortly.
We're live on Facebook. Good morning. My name is Joe Doherty. I'm the spokesman for the Utah Department of Public Safety and the state's COVID-19 response. Today's COVID response briefing for Thursday, January 28th, 2021 is beginning now. We'll start by hearing from our Governor, Spencer Cox, and he'll be followed by Lieutenant Governor Deidre Henderson, and then our state epidemiologist, Dr. Angela Dunn.
Thank you, Joe. Ladies and gentlemen, it's great to be back with you again this week. We appreciate all of you joining us for this update. It's been about a year since we launched the state's fight against COVID-19, and we have learned so many things over that past year, and we certainly still have more to do. But I want to take just a second to reflect, because I think it's important that we do this looking back over the difficulties of this past year, and we'll talk about some of those. But the fact that we are well into actually vaccinating people, that we have people that are getting their second doses and have immunity from this disease. Even the best experts were telling us a year ago that it would be at least 18 months and maybe a couple years before we could have vaccines that work. This is truly a miracle of modern science, and to everyone that has worked so hard to make that happen, we salute you and thank you for that. I'm pleased to report that as of today, 267,027 doses have been administered in the state of Utah. A week ago today, our total doses administered were 193,777. Now, again, this includes first and second doses, but that is a weekly increase of 73,250 doses. The first week in January, we could only do about 40,000 doses a week. So that increase is just tremendous, and so many partners have helped to make that work. We also received some other good news this week. You remember last week I talked to you about extra doses that were out there with some of our federal partners in our long-term care facilities. We were very pleased to announce this week that they will be transferring doses that were intended for them to the state of Utah. This will result in more than 28,000 total doses that can be given to high-risk people while CVS and Walgreens continue to vaccinate our long-term care facilities. They have been amazing. We love them. They've gone through every one of our long-term care facilities now and are starting on their second wave. and we appreciate their amazing work. We'll just now better regulate the amount of doses that they have and use the rest with our local health departments. We're also very pleased to announce that we received news from the new administration, from the Biden administration, that we have an increased allotment of Moderna vaccine that will be coming to the state starting next week and over the next 3 weeks. That means that our monthly allotment now will increase for Moderna and Pfizer from about 33,000 per week, which is where we have been, to about 40,000 doses per week, a little bit north of a 16% increase. And that's again, just great news. Those are our first doses that we'll be able to get into arms, again, prioritizing our 70 and over population, and making sure that over the course of the next month, we're able to get through all of them. President Biden also announced that the federal government will be purchasing 200 million doses, 100 million each of Pfizer and Moderna, expected to arrive later this year in time that we're able to get through the general public, which is great news. But even better news that we're hearing now, and again, all of this is tenuous, but exciting. As I mentioned before, there are 2 other vaccine candidates that are scheduled to go through the approval process in the coming weeks. The first one is Johnson & Johnson. We're hearing in February that approval could take place and is expected to take place, so that by the 1st of March, we will start to receive Johnson & Johnson vaccine, which is a single-dose vaccine, which is great news, and again, is already being manufactured, so that we will have significant increases in doses coming into the state of Utah, which is a really big deal for us. And then shortly thereafter, we're hopeful that the AstraZeneca vaccine, which has already been approved in several other countries across the world, will receive the approval here in the United States. So by April sometime, those doses will come into the state. And assuming those things happen, and again, tenuously, we could see a tripling or more of the weekly doses coming into the state of Utah. That will allow us now, for those that are kind of projecting ahead, right, March and April timeframes, to significantly increase the population that is eligible. So we'll again, using our age-based qualifications as well as comorbidities, and we're still working through that with the health department, exactly how they want to prioritize that. We're hoping to have an announcement next week on exactly which comorbidities and age groups will be in the next categories, so stay tuned to that. But if we can now start to get over 100,000 doses a week in March and April, that means we can go through those categories, significantly reduce the age limitations on getting the vaccine, and protect lots of lives. So I'm more optimistic now than I was even a week ago, and more optimistic than I've been at any time during our response over the past year. I also just want to mention, we've had questions about wasted doses, and if we've had wasted doses in the state. Certainly there have been news reports in other states of throwing away large batches of the vaccine that have expired. That is not happening in Utah. It has not happened. Again, my executive order required that doses be delivered in the week that they're received. We had a huge backlog, but none of that backlog were doses that expired. And the great news is, and the Lieutenant Governor will talk more about this, that we caught up. And our partners have been amazing there. I can tell you that we have done an audit of a report of wasted doses in the state, and we discovered that there were a total of 95 doses that were unable to be distributed. Most were because the vial or the syringes were broken in transit or in that delivery process, or due to vaccine being drawn into the syringe that was not able to be administered at that time for whatever reason, usually due to an improper reconstitution or the preparation of the vaccine. So I'll be clear, out of 395,000 doses that have been shipped, That is 0.0002% that have been wasted because we have the best people in the state doing this work. They're professionals, they're incredible, and it's nice. That's one thing we don't have to worry about. So I'm now excited to turn the microphone over to Lieutenant Governor Henderson. She will be followed by Dr. Dunn, and then I will come back for one final thought, and we'll take some questions. Lieutenant Governor.
Thank you, Governor. Good morning. Last week, I finished my tour of all 13 local health departments in the state of Utah. It was actually a really incredible experience and very eye-opening to see how different areas do things in different ways that meet the needs of the different people in their communities. I cannot stress enough the tremendous work that these local health workers are engaging in. It's monumental effort. They're partnering with members of their communities to make sure that they're getting vaccines in arms in a timely manner. Of course, there have been difficulties, and part of the reason that I went to all of these health departments was to identify, listen to them, and identify some of the difficulties and provide state resources to help mitigate those problems. And that has been happening. When I first started this tour, we had thousands of doses in the possession of local health departments that were older than 7 days. But as of last week, the end of last week, 100% of those old doses had been actually administered into arms, and as well as the doses that they received that week. So these are huge efforts. Utah County in particular, I want to give a shout out to. They experienced a lot of technical problems and other difficulties, but despite all of that, they actually really hustled, and they were able to get rid of all of their doses into the right arms by the end of last week, and they've just done an incredible job. And I'm really proud of them and all our other health departments around the state. Now, our local health departments, we've instructed them to actually compile a list of individuals who would like to be able to get an appointment, but haven't been able to get an appointment. And this is a problem that we're hearing across the board, is there are so many more people who want to get the vaccine right now, who qualify to get the vaccine, but who aren't able to get an appointment to get it, simply because we have more demand than we have supply. And we knew that that would be a problem. But the local health departments have been instructed to compile a list of individuals who haven't been able to get an appointment, and actually work with them as new doses become available to get them in, to get those doses. We've also instructed them to keep a standby list of qualifying individuals, people who are currently in categories that qualify for a vaccine right now, to be able to get any extra doses at the end of the day. I'm sure you've heard, each vial of vaccine oftentimes contains one or more doses than what it's supposed to contain, and they're able to get a little bit more out of there, or people don't show up for their appointments. So there's often a few doses at the end of each clinic that are left over at the end of the day, and these health departments have compiled lists of individuals who they can call at a moment's notice, kind of a standby list, that those individuals can come in and get those shots and not waste any doses. They're also identifying people who are homebound elderly people and others in vulnerable populations who need to have that vaccine taken to them, and they're working to do that as well. I want to talk a little bit about the capacity of our local health departments. This is one of the big things we've been trying to identify. As we anticipate a significant increase of supply of vaccine, we've been working to try to figure out what the capacity is for our local health departments. Right now, they've been administering about 33,000 prime doses every week, and that, as the governor mentioned, is going to increase starting next week. Currently, the capacity across all health departments is 77,400 a week. That's with the current resources and current plans that are in place. And we're working with them on plans to get a sustainable increase in capacity to 143,300 doses each week. And then we're also identifying what their max short-term capacity would be, and also working with our High Throughput Coalition to identify mass vaccination sites that we can get on board and be prepared for when those doses come into play. Right now, I just want to reiterate really quick, who gets the vaccine? It's first responders, all K-12 teachers, and also K-12 staff who have direct contact with students, and anyone over the age of 70. We encourage everyone to continue to be patient. There is a lot more people that want the vaccine than we have vaccine to actually give them, but that's going to change soon. We're really excited about this. This is what provides us all hope that this pandemic will end, and we're all working really hard. And I just want to give a shout out to our local health departments who have been absolutely incredible. Thank you.
Hey, good morning. So our rolling 7-day average of new cases is now 1,710. That's a decrease from last week when we were at 1,829. And our percent positivity average has also decreased. We're now at 18.3%, where last week we were at 19%. And our hospital utilization has decreased and is now, the referral ICU utilization is now at 89%. So all of these key indicators are definitely trending in the right direction. And as more Utahns get vaccinated, we expect this to continue and potentially even increase. However, we don't have enough Utahns vaccinated yet to be able to rely on vaccines as the only prevention measure. So we need to continue wearing masks, physical distancing, avoiding large gatherings, basically keep doing what we're doing because it's working. We are slowing the spread of COVID, we're protecting our hospitals, and we're preventing deaths. Thank you.
Thank you, Dr. Dunn. One thing that I failed to mention, and then I'll conclude, is that as we look towards that April timeframe and significant increases in doses, when the Lieutenant Governor talks about capacity, remember with the current vaccines, there's a first and second dose. So when we talk about the capacity increasing in our local health departments to over 100,000, that's 50,000 first doses, 50,000 second doses as those things change. So we are also starting the process now to onboard, and will be over the next few weeks, additional partners for when that excess vaccine comes in so that we can work with clinics and your neighborhood pharmacies, all of those types of different groups that will be able to help us expand exponentially the opportunities to deliver more vaccine as it becomes available. Now, the last thing I wanted to share, I wanted to briefly mention a report that was released earlier today by our Departments of Health and Human Services addressing mental health during the pandemic. There has certainly been this narrative out there that we have seen significant increases in suicides or overdose deaths. The good news is that that is not true. We have not seen increases in suicides or overdose deaths during the pandemic and during the past year. In fact, we have seen slight decreases in suicides over the past 3 years. I think we're one of the only states, if not the only state, where that has happened. At the same time, we've seen a significant increase in our population. And so that combination is statistically significant to have fewer suicides and significant population growth. Now, I want to be very clear what that means. Two things. First of all, it shows again how resilient the response of Utahns has been to this. It shows that people really are reaching out to their neighbors. People are reaching out to their friends. People are reaching out to strangers that they don't know and finding ways to connect, to help people through this very difficult time. The other thing I want to be very clear on is that there are people who unfortunately have died by suicide or by overdose death because of the pressures that they have faced economically or health-wise during this pandemic. And this does not lessen in any way the tragedy that has occurred there. It is also not to say that we should relent in any way in working on suicide and opioid prevention. Those numbers in Utah are still far too high. They're trending in the right direction. The efforts are working, but we still have so much more work to do. And I just want to remind you, those that are listening, that if you or a loved one are experiencing thoughts of suicide or crisis, that there is help available. I'll remind you that we have a suicide hotline in the state. That Utah crisis line is 1-800-273-8255. That's 1-800-273-TALK. And we would encourage you to use those resources. The Healthy Utah app is also available. Download that, utilize it, talk with a crisis professional who can help you. And with that, we're happy to answer some questions.
Hi, can you hear me okay?
I can.
So I'm asking, what is the state's current rule for how long after a positive test a person needs to wait to receive a vaccine? Previously, we'd heard there was some debate between 90 days or 60 days and maybe looking at changing that. And then also, is the state looking at changing that perhaps given the spread of new variants that may or may not, but it sounds like they may compromise the level of immunity that a person might have from a previous infection?
The recommendations from the CDC and those being followed by the state of Utah is 90 days. So we do not recommend getting the vaccine if you have tested positive within the last 90 days. There is no discussion, to my knowledge, of changing that in a significant way, either shortening it or lengthening it. There have been debates at the national level. I've certainly wished we were doing much longer than that. It doesn't make that much sense to me. We know that there is significant immunity. We know that it lasts more than 90 days. We've seen that, but I'm not the scientist, and the health experts are still recommending 90 days. And so that is the standard that we are adhering to in the state, and will unless and until there's a change nationally. Did I botch that? Are we okay? Okay. I got the thumbs up from the experts. Thanks, Dr. Dunn.
KUER, right?
Yes.
Okay, hi, Lexi Peary here from St. George. And I cover Southwest Utah, and I've heard from many seniors that they're frustrated about the process right now for registering for vaccines, since there are such a limited number of doses right now. And there's so many different priority groups trying to get them at the moment. Are there any plans to further break down these groups for the vaccine so it will streamline the process at all, or will the state be doing anything to help local health districts streamline the process?
So there won't be any changes in the groups that are available for that. Again, I've shared this many times, but in January when we came into office, we had a decision to make, and that decision was whether to overload the system or underwhelm the system. And we chose very distinctly to overwhelm the system. As the Lieutenant Governor reported, we wanted to burn through every dose of vaccine. We knew that would be frustrating for some people who are waiting their turn to get those doses. But that's a much better problem to have, and so we opted to that. What we are doing is trying to help every one of those local health districts to put in place a procedure that allows them to take the information of those that are qualified and then reach back out to them when there are additional doses available or additional scheduling times. That's something that we're very serious about, something that we want to see happen. We are also working with local health districts on another technical solution if they want to change their scheduling platforms right now. We will have a solution that is available to them in the next few days to migrate to a different platform that is likely more robust and can help them with some of those critical challenges that they're facing. But again, I want to emphasize that challenge is not slowing down the delivery of vaccines in any way. They are all maxed out, which is a much better problem to have.
Hi, Governor. It's Ben Winslow at Fox 13. With the anticipation that you may see more vaccine being rolled out and made available, significantly increasing your dosage availability, is there any discussion about when you'll start lifting restrictions that are currently in place, the mask mandate, physical distancing requirements, et cetera?
So we are starting those conversations, and we'll be working with the legislature and, of course, with the Department of Health and other experts to figure out what those points are as case numbers start to come down, as infection rates decrease, and as our most vulnerable population has access to the vaccine. There will come a time when we reach that threshold and make those changes. We haven't decided exactly what that is. Again, policymakers will be very involved in those conversations, but they are happening. I also want to to push back on this narrative a little bit that vaccines don't change anything and you can't change your behavior at all once you get your second dose and have that type of immunity. That's a really terrible narrative that is out there. I think it's not only is it wrong medically, but it's wrong and discourages people from getting the vaccine. This idea that, well, if I get the vaccine and nothing changes, then what are we doing? The truth is that people that have received the vaccine can spend and should spend time together, and that you should be able to hug your grandkids and those types of things once you get that. And so we'll continue to work. And again, this is a national issue. There was a great article in the Atlantic yesterday that I recommend people read about that very issue, and making sure that we are projecting hope to people that there is an end to this, and both individually and collectively. And so as we work through what that looks like on the collective piece, we will obviously keep people informed and make those decisions in the coming weeks.
Hi, two really quick questions. One is, when we get those new vaccines, how is it chosen who gets which vaccine? Because I understand that those newer Johnson & Johnson, AstraZeneca might not quite be as effective. So just wondering how that works. And also, how will people have to prove that they have comorbidities?
Yeah, both very great questions, and these are questions that all governors and again the scientists and the experts, the healthcare professionals are going to be grappling with over the next couple weeks. We'll want to see the effective rate of those other vaccines, and so you can imagine a conversation where we try to preserve the most efficient vaccines that give the highest rates of protection to those that are most vulnerable, and use the vaccines that maybe have a little bit less effective rate for those that are less vulnerable. Also, we have to weigh the one dose versus multiple doses, and which communities will that help. We will start to see now, as our numbers have increased, we'll start to see the return rate for people coming back for their second dose, and get a better understanding. Getting one dose of Johnson & Johnson, hypothetically, and I shouldn't do hypotheticals, but let's say it's 80-85%, and we find out that and two doses of Moderna is 95%, but one dose of Moderna is 75%. Whatever those work out, there's some real thought that has to go into that, and those conversations are happening right now. When it comes to evidence of comorbidities, though, this is something we've also been grappling with, and the problem is, if you require evidence of those comorbidities, it will slow the process down, right? Every qualification and piece of paperwork that we put into the process slows the number of doses we can deliver, or conversely increases the number of people we need to process those. And so we've made the decision, we've made this at age that we are working on the honor system. And we know that there will be some people who try to cheat that system. That's very disappointing. But it will happen. But again, we would rather err on the side of getting more people through the process than limiting it. Now, that wouldn't be a problem if we had unlimited doses. And so we're less worried about that as we look at the numbers potentially in March, April, and May. It's a lot more significant when you only have 33,000 doses a week to try to really get those to the most vulnerable. And that's what we're trying to do. And so I would obviously encourage people not to cheat the system, but we're not going to require extensive paperwork to prove those comorbidities. At least right now, that's the plan.
Oh, sorry. I think it's the APs. Hi, Governor Cox. This is Sophia Eppolito with the Associated Press. I wanted to ask, this may be a question for you or Dr. Dunn, but previously we had data on the state's coronavirus website that showed not only the number of doses administered, but the numbers that had been shipped to the state and how many were here. Are there any plans to add that data back just so we have a better sense of how many vaccines are being received by the state, what % is being used, that kind of thing?
Do you want to take it on? Yeah. We do have an answer on that. We've been talking about it. Either one of you or I can do it. Go ahead. Yeah.
You know, so the reason why we took it down is because it wasn't quality data, and we hold the highest integrity with our dashboard and want to make sure we're giving the public accurate data. And so when we started this new process of vaccinations and combining a lot of different data systems, it came out that that data just wasn't good. So we've been working really hard over the past couple of weeks to make sure we can present good data, and that is on our plan and our upcoming dashboard updates to include that. But I can tell you that we've had 395,000-ish doses shipped to Utah thus far, and we do plan on making that public in the future.
Thank you.
The other piece of that I would just add, and again, those are first and second doses that have been delivered. And as I mentioned last week, every one of those second doses has basically a name attached to it. People that got first doses will release those second doses after 7 days of people that don't show up to become first doses. But also that data piece is so important. And we had all these different partners that had vaccine, and getting accurate data from them was a challenge. We have audited every one of those. We know where every dose is in the state and who is responsible for those doses. And so that upgrade is going to be so important, and we're excited to release that information. Last one.
Hi, this is Haley Hendricks with ABC4 News. This is a question for Dr. Dunn, and then Governor Cox, if you have anything to add, that is great as well. So the CDC projects the UK variant will become the dominant strain of COVID-19 in the US by March. Now, a health department spokesperson told me Wednesday there's only been 2 confirmed cases of the UK variant in Utah so far. But if experts believe that this will become the dominant strain, how are you preparing for this? And is it possible we could see another surge in cases?
Yeah, absolutely. So we have confirmed 2 confirmed cases of the UK variant here in Utah. But keep in mind, we're only sequencing 10% of all of our positives, which is a lot compared nationally to other states, but we're still not able to sequence every single person who becomes positive. So the fact that we found 2 means that it's here, right? It's already community spread. And so that means we have to be extra cautious when it comes to taking prevention measures. We're fortunate that the vaccine is effective against this UK variant, so that's going to help. But the same measures we've been practicing throughout this pandemic, mask wearing, physical distancing, avoiding large gatherings, work at preventing the spread of the UK variant as well. So that makes it even more important to do it, knowing that the UK variant's more transmissible, meaning it can infect more people more easily, and to get the vaccine when it's your turn. That will ensure that we don't experience another surge and we keep our cases trending downward.
Thank you very much.
Thank you, Dr. Dunn. And the only thing I would add to that, and I mentioned this last week, is that we encourage people, if you can, to upgrade the quality of your masks. We're also working with the incoming administration, the new administration, on getting more and better masks out to people, because we know that, again, that is incredibly effective and can protect the right quality mask protects the user as well as those around them, and that's why we are encouraging that. So with that, again, thank you all for being here today. We look forward to seeing you back again next week. Take care.
All right, we're going to excuse the governor for right now. Dr. Dunn is still available if anyone in the media still have further questions for her. I see a couple hands raised, so I'll step over to the side.
Who goes first?
Great, thank you. Hey, Dr. Dunn, Chris Green with St. George News. If you could address the mental health report this morning. And I know both the governor and certainly the release talk about the programs here being a big credit to that. Still, a lot of people might be surprised that we are not seeing an increase in suicides and other mental issues. What else do you think has occurred to keep this from happening? And what have you done personally to keep your mental health up through all this?
Sure. So I will give credit to the Department of Health and Human Services that at the very beginning of this pandemic, so a year ago, we started planning for addressing the mental health strain that would come with the pandemic, quarantine, social distancing. And so we've been working with partners for over a year to focus on this effort. And I think the fact that we haven't seen an increase in suicides or overdoses is a testament to the hard work that's been put in by both our health and human services departments. We have to remember, though, that this is a pandemic that will take a toll on us for several more months. So we need to continue emphasizing those kind of prevention measures to continue that going, even as we start seeing less cases. We still need to continue physical distancing and those things. Me personally, I feel like I'm lucky because I still go to work every day. And that, of course, is a different position than a lot of people. So relatively, I've likely had a really much easier time than other Utahns out there.
Hi, Dr. Dunn. This is Paul Nelson with KSL News Radio. The governor mentioned that conversations are happening about when the day would be when maybe we don't have to have the mask mandates and the practice social distancing as much as we are. Has the federal government, the CDC, have they given any kind of, say, guideline on what those thresholds would be as far as when we could let up with stuff like that?
The conversations are so in the beginning right now, and there's so many things that have to go right for us to be able to get to that point. Manufacturing of vaccines is not a small variability there. The introduction of new variants is going to impact that. So even though it's so tempting to want to say this is when the end of the pandemic will be, or this is when we don't have to wear masks, it's really, really, really tough to predict that accurately. So I will say that, once we get 80% or so of our population vaccinated, and we're just seeing sporadic cases of COVID, that is when we as public health will consider it over. But in terms of prevention measures, we'll have to see all these other things that have to happen with the variants in the vaccine to determine when these other prevention measures can be let up.
Yes. Hi, Dr. Dunn. I'm wondering if you could follow up on what the governor said about messaging with the vaccine. My understanding is that no one knows whether you can still transmit the virus after you're vaccinated. So you do still need to take care about wearing a mask, social distancing, avoiding large gatherings, where you'll be around people who aren't vaccinated. Is that correct? And what's your messaging there as a health professional? What should people do once they're vaccinated? Can they hug their grandkids, or is there a possibility they'll spread, especially with this much more transmissible, contagious variant already in Utah and others on the way? Thank you.
Sure. So something, of course, that we've had throughout the past year is that we're learning new things every single day. And the fact that the vaccines were produced and went through phase 1, 2, and 3 trials so quickly means that the vaccines haven't been around that long, right? So understanding how long immunity lasts and how well that immunity is from transmitting the disease, but also protecting the individual, are still kind of unknown because we just haven't had a lot of time. I will tell you that it is encouraging that recent studies are showing that individuals are protected for up to 8 months, and we are confident that that will likely be extended. There is still a lack of evidence in terms of, does the vaccine prevent you from transmitting asymptomatically? We know that the vast majority of our cases that aren't vaccinated are transmitting asymptomatically. We just have to understand how the vaccine interrupts that. We're all very hopeful in the health and science world that the vaccine does prevent transmission of the disease. But again, it's something that time will tell us. So I will say for everybody out there that's vaccinated, you know, our recommendations and our rules are that 2 weeks after your second dose, you don't have to be quarantined if you're exposed to someone, right? You likely won't be infected. But if you know, are around vulnerable populations that aren't vaccinated, it's important that you still take precautions so that you're not infecting those who could be at high risk for hospitalization or death. Okay, perfect. Thank you, guys.
All right, we want to thank our speakers, Governor Cox, Lieutenant Governor Henderson, and Dr. Dunn. We always appreciate our interpreters for American Sign Language and Spanish. And our next regular briefing is scheduled for February 4th. So this concludes our briefing. Thank you very much.